Our program's been around for almost 50 years. We've trained some of the top healthcare leaders in our state, in our region, in fact, all across the United States.
We actually very intentionally spoke with stakeholders, so in terms of alumni, students, faculty, practitioners in the field, and really surveyed them for what skills, knowledge they thought that future healthcare leaders would need.
We've made changes to the curriculum. We've recruited faculty members with the expertise to meet those needs. And we are now, I'm proud to say, training our students for all of those things at a world-class level.
My favorite class so far in the MHA program has to be my Lean class.
Lean, if I were to describe it, is basically enabling team members, or in this case students, to become problem solvers. It teaches the fundamental techniques for problem solving, and it does so in a very systematic form.
And it's basically founded on two different principles. One is continuous improvement, and the second is respect for people. And so that class applied those principles in the field of healthcare.
She taught us the Lean principles, but she also taught us the leadership way of how to be a Lean leader. And so I got a lot of value from that class.
I really liked our strategy class because we were able to work on a case, and just gives you really good experience for learning how to problem solve and approach a complex situation.
In many ways, leaders have to position their organizations for harmony given the changing environment that they're in. And so strategic planning is the process by which a leader of an organization identifies what needs to happen for that organization to continue to be successful.
I had to take 2 accounting courses, and the second one is a healthcare finance course taught by Gary Brummett, and I really enjoyed that class. I am terrible at math, and it was really difficult, so it was a challenge in itself, which was kind of tough but fun.
What I try to do is I try to demystify finance.
I like him a lot because I felt like he knew how to take the concept and apply it to a situation, and looking at healthcare from a whole new perspective for me that I had never looked at before.
Irrespective of where you go in healthcare, having a good set of finance skills is important for you to sustain the organization's existence.
We have used the Human Resources course to bring in the whole governance structure for healthcare organizations, because really Human Resources strategy starts with governance and how the organization is governed by a board of trustees.
I really enjoyed that because it gives you some aspects and insight into theories as to why people say and do the things they do. Being a part of an industry that is very people-driven and focused, I think that's essential to at least understanding that to the best of your abilities, so that it makes your job easier and you can give better quality of care to people as well.
I think the most exciting conclusion that we've come to in the past year is that the curriculum needs to be dynamic. And we're all committed to consistently harvesting feedback from the practitioners and alumni and students and faculty to make sure that we're constantly adjusting the curriculum to meet the future needs.